name is Preethu.
Sean.
Lauren.
Srihari.
Josh.
I'm 13, 19,
16,
14, 15 years old.
I'm from Calgary.
Macomb.
Canmore, Red Deer, Okotoks, Alberta.
I've been a part of KAYAK for the past 3 years.
2 years.
6 years.
1 year.
7 years.
My healthcare experiences include being a volunteer at the Red Deer Regional Hospital,
I'm a sibling of a patient.
I battled cancer when I was 8 years old.
as well as an outpatient with mental health.
I had an orthopedic surgery on my hip, and then I now have chronic pain.
I believe I bring sort of the sport-related injury side to KAYAK.
What is KAYAK?
We provide a youth perspective.
For child and youth health programs and services.
KAYAK started in 2003.
We meet 6 Saturdays a year at the Alberta Children's Hospital.
We work in a lot of small groups.
So that no voice is lost.
KAYAK consults for various Alberta Health Services and Alberta Children's Hospital groups.
We work as a team.
We're passionate about improving the quality of the healthcare system.
Last year, KAYAK members volunteered over 1,300 hours.
We did 14 different consultations and represented the youth voice on 17 different committees.
We're from the Shaganapi Community Health Center.
Dr. Gordon Townsend School. Emergency Department.
Patient safety.
Sexual and reproductive health program with Calgary Zone.
Nutrition and food services at the Children's Hospital opted to consult with KAYAK.
To develop a better understanding of what patients' experiences are and if they've had contact with school, and if they haven't, why not.
And we introduced a new menu for our inpatients.
To conduct a research study on an innovative approach to providing current, relevant, and evidence-based health promotion messages to adolescents.
Project in the emergency involving wrist fractures and providing families a choice between casts versus splints.
Replacement of sugar-sweetened beverages.
And one of the big questions is, what were we going to call it?
In particular, our social media strategies.
It was really important for me to engage with that group, most of them having spent some time in our hospital, but also from that age demographic.
Why come to KAYAK?
We'll tell you what we like, what we don't like, and why.
We'll help you plan, review, and redesign what you've completed so far.
We'll give you ideas on how to connect with a youth audience.
We want to provide a voice that directly impacts others.
For some of us, it's about getting involved.
For others, it's about giving back.
Or paying it forward. We want to make a positive change in our community. I've learned how to collaborate. I've learned leadership skills. I've learned about healthcare.
I feel included.
I've made good friends.
I'm able to use my healthcare experience to do something positive.
I can see our voices have made a difference.
The KAYAK group was able to help us shape selections in both ways for both the patient menu and those beverages that we offer in our cafeteria.
Youth was able to tell us what platforms they're using, and that's great feedback for Alberta Health Services so that we can use our messaging and put it in the places that it's actually going to be heard.
You've had an opportunity to improve overall how many services we're offering and try to increase our profile across the hospital.
Since our consultation with KAYAK, we actually have been approved for our research study.
They came up with Safest Together, and that resonated not only with us in the room but also with Edmonton, and that is now the official program for improving patient safety.
They ended up making our handouts and sheets much more patient-friendly, much more easy to understand. They also helped us to anticipate some of the questions families might ask.
It's been really useful to work with KAYAK because KAYAK brings a variety of youth to one space in a focus group type environment where we can come and work with them and find out their needs. It gives youth a voice.
We are